our real pleasure today to be presenting here to you at the MedTech Strategist in Investment and Partnering Summit. I'm here today with my colleague Martin. My name is Anke. We are from the High-Tech Gründer Fund, and we are today going to share our experience on cooperations between MedTech corporates and startup. As I said, my name is Anke. I'm in the investment team of the High-Tech Gründer Fund. However, before that, I have a long history in MedTech corporates, and I have the pleasure to share this presentation with Martin.
Thanks, Anke. I'm Martin Pfister. I'm an immunologist by training with the HCGF since 10 years. Before that, I've co-founded 2 startups, so we both represent the corporate and the startup world. In the next slide, I would like to introduce our fund. HCGF has been introduced 15 years ago, we have about 900 million euro under management. And we operate like a typical early stage investor. So we invest in an investment phase, and then we have a little longer divestment phase where we try to exit our companies. Usually we do seed investments in companies not older than 3 years that have some legal activities in Germany where money is spent. We invest up to 3 million per company over the lifespan of the company, and usually start with tickets between 500k and 1 million. And what you can see here in this slide is that what changes over the fund generations between Fund 1 and Fund 3 is the number of limited partners, investors that we have in our fund. Right now we have over 30 mid-cap and large-cap companies that invested our fund, and the reason why they have done so is of course return on investment, but more so the access to innovation and technologies that they would get that they usually don't have or not within their core business. And amongst those investors in our funds are 2 MedTech companies, Traeger and B. Braun. With 900 million you can do a lot, so we have invested in a lot of startup companies, and our active portfolio is about 270 companies, and 40 of those are in the MedTech space.
This is true. We indeed have a number of MedTech companies in our portfolio, starting with the digital health companies, where we have been in very early investors, and for some of them we already have financed for several years. We also have classical MedTech investments, which we here have presented in their various fields, ranging from patient monitoring to aesthetics, and of course including important fields like cardiovascular devices, emergency care, neuromodulation, orthopedics. So I would say we do have a lot of experience on cooperations between startups and corporates in the MedTech field, and we are happy to share that. So maybe with this I'll hand over to you, Martin.
Yeah, I would like to show you in the next slide a couple of key questions that a corporate might have while or before working with a startup company. And these are the 6 W questions, and I just would like to highlight 2 from a point of view that a startup has. One major is that you might ask yourself as a corporate, depending on the model that you choose incorporating with startup companies, so what are the internal stakeholders that are driving the process? Because studies have shown that one of the major success factors of corporations between a large corporate and startup companies are the people within the corporate company that are driving the process. And of course the resources that you could allocate to this process in terms of budget and of course HR. Anke, from point of view of a corporate, what of those six questions would be those that you would choose?
I would say one of the first questions which is always coming up is the question, why is this different, what the startup offers, from what could be developed internally? This is always a very big discussion. Nonetheless, the answer can be it is different, or it can be no, it's not different. And what we are seeing in our fund, with our fund analysis and with our startups, for example, with Big Brown, we are seeing they very easily cooperate with digital health companies because that is different from what they have done so far. And it really gives them a push into the market when they cooperate with a startup in the digital health field and so can enrich their product offering.
Interesting. But I would suppose there comes a number of risks with this cooperation. Would you like to pick of those 5 risks that we have put up here for corporates, one that you might highlight on?
Yeah, there is of course a big risk in that from the corporate point of view, because a lot of the products from the startups are pre-commercial, immature, and it is very hard to judge where the issues with the customers might arise. The corporate has a reputation for certain service quality they are offering to their customers, and then all of a sudden, especially if you think about my example with the digital health product, a lot of questions comes up, and the corporate really has to look into how can I mitigate the risk that might come up from the product being immature. Would there be any risks from the startup side?
Yeah, something that might be even related to what you have said before. Out of those 5, I would pick the issue that the setup that you have with the startup companies might be too premature for scaling up. So if you then have worked with the corporate, you have set up JDAs, you've prepared all the materials, and then you start a corporation, you get the offer, and you have to scale your production, and your production is not large enough to produce all those numbers, those products, those volumes, because especially early stage VCs that tend not to invest in bricks and stones, not into production sites, and this is a major risk. So there are a couple of solutions to this that you might hopefully involve corporates with setting up this kind of production and maybe co-investing in, but it's a major risk. You have then to allocate too much resources to this one corporation and defocus, a point that investors also don't like very much.
It certainly does sound like a huge risk. However, I would assume there are also returns for the startup. Otherwise, why would they do it?
We are in the startup world, and startups used to take risks and usually weigh benefits more than risks. And amongst those 5 benefits for a startup company, I would clearly highlight one, that is the access to proprietary assets or know-how. Because as a startup, you might have your focus on a product or a product line, but if you then work with a corporate, an experience in our portfolio has been the cooperation between Medineering, active in the field of surgical robotics, and BrainLab, where several R&D cooperations that led to increasing cooperation between those 2 companies, and at the end, BrainLab bought all the shares of Medineering, a great exit for us as an investor, but also for the startup companies. Another example would be Novapump, a company in my portfolio that develops heart assist devices, a very special field, and with not a lot of customer involvement. And we set up a cooperation with Getinge that will not only bring money to the table, but also a lot of know-how in terms of how would key opinion leaders, how would potential customers, have to have the product, and this really speeds up the process. So this access to know-how is an important benefit for startup companies, but the same, I think, is true for corporates.
This is true. I would also say it's access to know-how, what they are also looking for. Of course, it's a different know-how they are looking for. One of the main drivers for the corporates, I believe, in today's world is that they want to have a complete solution product offering for the customers to defend their position in the market, and to achieve this, to really bring to your customer everything they need to solve their problems. They just need to go out and look at the innovation which is out there and then internalize, integrate, and have all the technologies, because in the end, it is all about bringing things together, bringing things to the customer in healthcare. And I think that the take-home message we are having from what we are seeing in the cooperations between MedTechs and the startup world is, yes, it is a relationship of hope and challenges. You really have to understand how the other one is thinking, and if you're doing this, it really is the best way to bring healthcare innovation to the patient.
Sure. So, but before we say goodbye, there's one remaining question, because one of the DNA of startups is to interrupt or disrupt technology. So, you as a corporate, would you disrupt your own market?
That is an excellent question, I think. Many will answer it with yes, because I think that the rationale is, when I'm the market leader, it's better that I'm disrupting the market than someone else does it for me, because in today's world, very often the disruptor is the winner. So when a market is ripe for disruption, as a corporate, I'm better there in the leading seat.
Yeah, that's true. Well, that's the end of our small talk. We are Anke and Martin, and we have talked about cooperation between meta corporates and startup companies, the basic that you can learn only by doing. We would be happy to interact with you during this conference, and looking forward to get in touch. Thank you.